Recording in progress. Hello, my name is Francisco, and I want to go reading the unit 1 to 5, health and illness. Asking about health. Health is the state of the body. When doctors want to know about patients' usual health, they ask questions such as, what is your general health like? How's your health general? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Not ill fit, not ill healthy, not ill fit and well, not ill well, very well, not ill in good, ill in fit, ill and well, ill poorly, ill in poor health, ill not well, not very well. In Spanish is salud y enfermedad. Preguntar por la salud. La salud es el estado del cuerpo. Cuando los médicos quieren conocer la salud habitual del paciente, hacen preguntas como, ¿cómo es su salud en general? ¿Cómo es su salud en general? Generalmente. ¿Cómo está su salud generalmente? ¿Se goza de buena salud? ¿Está bien y no tiene ninguna enfermedad? Si está sano, normalmente está bien y puede resistir la enfermedad. Si estás en forma, estás bien y fuerte. Apto y bien, estás apto y bien. Saludable, no saludable. No apto, no bien. Muy bien, no enfermo. Con buena salud, no bien. No enfermo, no muy bien. Muy mal o con mala salud. Sickness. Sickness has a similar meaning to illness. It's also used in the name of a few specific diseases. For example, sleeping snakes and travel snakes patients also talk about snakes when they mean nausea and vomiting and vomiting. Patient says, I was sick this morning. I feel sick. Possible meaning. I was ill this morning. I feel unwell this morning. I vomit this morning. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can all say the patient made a good recovery. The patient made good. The patient made a complete recovery. If a patient's health in the process of returning to normal, the patient is improving. This opposite is deteriorating. We can also say that the patient condition improves of deteriorates. In speech, we often use the verb get to talk about change, get over an illness, get better, get worse, to recover, to improve, to deteriorate. If a patient is better but then gets worse again, the patient has really another word for improvement, especially in recurring conditions such as cancer, is remission. It got over the illness very quickly. 2 years later, she means incomplete remission. In Spanish, enfermedad means Nix tiene un significado similar a enfermedad. También se utiliza en los nombres de algunas enfermedades específicas. Por ejemplo, la enfermedad del sueño y la enfermedad del viajero. Los pacientes también hablan de enfermedades cuando se refieren a náuseas y vómitos. El paciente dice que estaba enfermo esta mañana. El paciente dice que estaba, o sea, que pues, me siento enfermo. Los posibles significados serían el posible significado es: estuve enfermo esta mañana, me sentí mal esta mañana, vomité esta mañana. La combinación de enfermedad y diarrea significa vómitos y diarrea. Recuperación. Cuando los pacientes recuperan su salud normal después de una enfermedad, se han recuperado. También pueden decir, el paciente se siente bien, el paciente está bien, el paciente está completo, el paciente está recuperado. Si la salud de un paciente está en proceso de volver a la normalidad, el paciente está mejorando. El paciente está mejorando. Lo contrario es se está deteriorando. Entonces, también podemos decir que el estado del paciente mejoró o se deterioró. En el habla a menudo usamos el verbo get para hablar de cambios, como get, bueno, completo, recuperación completa. The exercise. Complete the table with words for A and B, opposite. The first one has been done for you. Nouns, adjective. Fitness, fit. Health, health. Illness, health. sickness, sick. Make word combination using a word from each box. Look at B and C opposite to help you complete remission. Feel sick, get over. Poor health, trouble, sickness. Complete the conversation. Look at B opposite to help you. Doctor and patients. How are you feeling today? Not very well. Not very good. How long have you been feeling sick? About about a week. What is your hair like normal? Very good. I'm usually quite healthy and fit. What is the problem now? Is my stomach. Do you feel sick? Yes. Have you actually been vomiting? Vomiting? No. Have you had any serious illness in the past? No. None of all. Use the correct word to complete each sentence. Look at B and C opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to get home from hospital. The cause of sleeping sickness was recovered in 1901. The patient made a full recovery. I have been in good health for months and feel very fit. It was a month before I get over the illness. He seems to be rather until his diet is bad and he never exercise. Chapter 2. Part of the body. Part of the body. Most external parts of the body have ordinary English naming, as well as anatomical name. Doctors normally use the English name, even when talking to each other. There are a few exceptions where doctors use the anatomical naming. These are shown, shown in brackets below. Jaw, jaw, neck, shoulder, armpit, axilla, mandible, upper arm, elbow, back, bottom, wrist, think, calf, leg, chest, breast, stomach, tummy, abdomen, navel, hip, groin, neck, shin, kneecap. En Spanish es, en español es partes del cuerpo. Partes del cuerpo. La mayoría de las partes externas del cuerpo tienen nombres comunes en inglés, así como nombres anatómicos. Los médicos normalmente usan los nombres en inglés, incluso cuando hablan entre ellos. Hay algunas excepciones en las que los médicos usan el nombre anatómico. Estos se muestra entre paréntesis, lo que vamos a ver ahora, que están entre paréntesis. Por ejemplo, la primera, mandíbula, cuello, hombro, axila, partes superiores del brazo, codo, espalda, glúteos, muñeca, muslo, pantorrilla, pierna, pecho, tórax, mama, estómago, barriga o abdomen, ombligo, cadera, ingle, rodilla, región inguinal, espinilla o rótula. Okay. Okay. Referring to part of the body. When patients speak about their problem, they often refer a part of the body. I'm having trouble with my head, my shoulder, my neck. The doctor often needs to ask about a part of the body. Do you get any pain in your chest, in your stomach, in the back? Okay. En Spanish es refiriéndose a las partes del cuerpo. Cuando los pacientes hablan de su problema, a menudo se refieren a una parte del cuerpo. Bien, una parte del cuerpo. Estoy teniendo problemas con mi brazo, o sea, con mis extremidades superiores o con mi pierna, tronco o el cuerpo. Estoy teniendo, ¿tiene algún dolor ¿Tiene usted algún dolor en el estómago o en la espalda? Where is the ordinary English word for the corresponding anatomical terms in the table using your medical knowledge? Look at A, opposite to help you. Anatomical terms. Common words. Abdomen, stomach, tummy, axilla, armpit, corpus, waist, coccyx, hip, cervix, elbow, mama, breast, neck, burk, patella, kneecap. Complete the sentence. Using ordinal English word, look at A and see opposite to have you. A. A male patient described angina pectoris. It's like a tightness across my chest and it goes up to my neck and into my left shoulder and down the left arm. D. A male patient describing renal colic. It starts back at the loin and goes into the down and going into the testicle. Complete the sentence. Look at A, opposite to help you. Anatomical terms. Inguinal swelling, abdominal pain, periumbilical rash, thoracic pain, enlarged axillary node, mandibular pain, Patient started. I've got a lump in the armpit. My little boy's got a tummy ache. I've got some spots around my navel. I've got a pain in the middle of the chest. There are painful swelling in my groin. I've got a pain in my lap. Complete the table with work for the boss. The few ones have been done for you. Abdomen, neck, elbow, chest, lung, arm, wrist, leg, thigh, finger, throat, abdomen, chest, line, upper limb, wrist, elbow, arm, lower limb, neck, leg, thigh, finger. Let me see. Chapter 3, part of the body 2. The abdomen, the main organ of the body, has ordinary English name, and doctors use the word or, but when an adjective is needed, they often use an anatomical word. For example, we can say this days, days of the labor or hepatic disease. Some abdominal organ, for example, the pancreas has ordinal name, pancreas, duodenum, gallbladder, liver, stomach, spleen, right kidney, left kidney. Partes del cuerpo 2, el abdomen, en español. Los órganos principales del cuerpo tienen nombres comunes en inglés y los médicos usan estas palabras, pero cuando se necesita un adjetivo, a menudo usan las palabras anatómicas. Por ejemplo, podemos decir enfermedad del hígado o enfermedad hepática. Algunos órganos abdominales, por ejemplo el páncreas, no tienen un nombre ordinario, o sea que se llaman igual. Por ejemplo, abdomen visto desde abajo. Por ejemplo, páncreas, duodeno, vesícula biliar, estómago, vaso, riñón izquierdo, riñón derecho y el hígado. When doctors talk about the main part of the digestive system, they're using the word bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctor may refer to anus and rectum as the back passage, the chest. Cuando los médicos hablan de las partes principales del sistema digestivo, usa la palabra intestino o intestino. El intestino delgado o el intestino grueso. Al hablar con los pacientes, los médicos pueden referirse al ano y al recto como el conducto de la espalda. The chest. The chest thorax contains the organ of respiration and the heart. The main part of the respiratory system are the airways and lungs. The left lung is divided into two lobes and the right into three. The airways consist of the larynx, the trachea, or with face, the right and the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to the patient. The bladder is situated in the pelvis, as you know, and in connecting to each kidney by a long tube calling the ureter on each side. The ureter carries the urine from the kidney to the bladder, where it stored until you decide to empty your bladder. When that happens, the urine takes down another tube called the urethra to the outside. El pecho o tórax contiene los órganos de la respiración y el corazón. Las partes principales de las vías respiratorias son las vías respiratorias y los pulmones. El pulmón izquierdo se divide en dos lóbulos y el derecho en tres. Las vías respiratorias consisten en la laringe, la tráquea, los bronquios derechos, izquierdos y los bronquiolos. El pecho está separado del abdomen por el diafragma. La vejiga está situada en la pelvis, como saben, y está conectada a cada riñón por un tubo largo llamado uretra, uno de cada lado. Los uréteres transportan la orina desde los riñones hasta la vejiga, donde se almacenan hasta que decida vaciar la vejiga. Cuando eso sucede, la orina pasa por otro conducto llamado uretra hacia el exterior. The exercise in English. Level the diagram using more from the box. Look at B opposite to help you. Diaphragm, lungs, lungs, iris, windpipe, pipe, heart, bronchioles. In this picture, the answer is one page. Lungs, lungs, diaphragm, bronchioles, heart, airways. Match the condition with the organ affected using your medical knowledge. Hepatic, liver, liver, pneumonia, lungs, nephritis, kidneys, gastric ulcer, stomach, cystitis, bladder, hernia pectoris, heart, cholecystitis, gallbladder, ulcerative colitis, large bowel. Complete the textbook extract, look at A and C opposite to have you. Examination of the abdomen. To examination the patient for a large abdominal organ, fearful for the life and gallbladder on the right side. To do this, ask the patient to take a deep breath with breathing the finger upward and inward, next to the right kidney, and the cross over the other side for the left kidney. Still on the left side, help papers for an enlarged sleeping. Finally, moving to the lower abdomen, feel for the bladder, which is only fit it is full. Good. It's all for the chapter 1 to 4. To 4. I'm finished to the class.